Hello, and welcome to Care Conversations. This is episode 4. My name is Jesse. I'm the Communications Manager here at Sioux Health Center, and I'm your host. Each episode will be taking you a bit behind the scenes of what goes on here at SLMHC. We're excited to be joined by Jade Beaulne, who manages our Human Resources Department. Jade's going to be talking to us a bit about the different career opportunities we have here at SLMHC for a variety of experience levels. We'll also be talking about the unique professional environment here and how that opens up the doors for further opportunities for education, training, and cultural experiences. Today we're excited to have Jade join us on this episode of the Care Conversations podcast. We appreciate your time today, Jade. I know with us being a healthcare facility, I think it would be easy for people to assume that certain positions you would need, a certain level of education, experience, training, that sort of thing. But actually, we actually offer a whole lot of opportunities for a variety of kind of career levels and where people are at. So just wanted to start off with kind of what makes Meno just that ideal place for people to kind of either start their career or continue growing and just meet them where they're at.
Thank you so much, Jesse, for having me. So yeah, our hospital is definitely somewhere where a lot of new grads or people at any stage in their life will come to start their career. We have various different positions that people after they graduate college or university will move up here to start their career. Our hospital is very unique as we serve the 28 First Nation communities, and we are a very busy hospital, as most of you will know, for the size of our community. So people will move up here and get really good hands-on experience from the diverse work environment that we have, including people of all ages, cultures, and backgrounds. And we are a very inclusive culture within Meno by ensuring that we are committing to diversity, equity, and inclusion. People really are here to increase their professional development and continuous learning, as we offer so many different learning opportunities within the hospital, as well as we offer a comprehensive benefits package for full-time employees, including paid time off, which lots of people enjoy. Retirement plan, our Hoop pension plan is really great, and it's transferable to any Ontario hospital, which is really great for people that are planning on staying in healthcare throughout their career. We have health and dental coverage, but yeah, we're really here to support our staff both personally and professionally to help them grow throughout their career, and we always think that it's an excellent choice for people to start their career here.
No, that's great. And I know the past few years, actually, Meno's been recognized just through the Canadian Mental Health Association just for a commitment to workplace mental health. And I just wanted to ask you, just how does our unique professional environment kind of contribute to that recognition and that commitment to mental health?
Yeah, for sure. The work environment has definitely changed throughout the last few years, especially after the pandemic. Healthcare workers really did go through a difficult time. Our hospital is both unionized and non-unionized, so we have to be careful on what we're able to offer, but we do our best to provide that work-life balance for new staff. We look at ways that we could offer innovative scheduling for departments that are interested in that. So there could be they work 10 hours or they work an extra 45 minutes and they get every second Friday off, for example. But it just has to be something that the union looks into with the manager and the department. And then our hospital is located in a beautiful location. We're really close to a lot of outdoor trails that staff can easily access. We're really close to Cedar Bay that has a lot of hiking trails, a trail down to the water, there's ski trails. So someone that really enjoys the outdoors, we always recommend coming up and working here because you're so close to everything that you're able to just go to the lake 5 minutes after you leave work and you can sit on the beach. And then further to workplace mental health, we do provide our staff an employee family assistance program, which is there's mental health counseling services. If that's something that our staff are in need of, we provide them with the resources. And then lastly, we do have a wellness committee that plans different events that go on at our hospital for staff to boost morale and wellness. So for example, we do walking challenges, we offer snowshoe rentals for staff for free, and then we do other events outside of work that staff are able to like hang out with people that they work with outside of work, such as bocce or golf nights. And further to that, we do offer a fitness 50-50 for our staff where they can get reimbursement for any athletic or sports thing that they do throughout the year.
No, that's perfect. And for anyone maybe looking to grow their leadership skills, or they're at the point where they're really looking at career advancement, what can they expect here at Meno?
Yeah, for sure. There is definitely areas for people to advance if that's something that they aspire to do. So first and foremost, we really recommend if you are interested in a leadership position within the hospital that you advise your direct manager of that. Just say, hey, like in the future, if anything comes up that you think that I'd be a good fit for in leadership, that's something that I'd be really interested in. And then your manager can work with you to take the right steps to plan or get you to that level, because they're coming from an employee to a manager, there's a lot more responsibility. So your manager could work with you on taking leadership courses or classes just to give you the right tools if that opportunity does come one day. We do prioritize promoting within. Our commitment to internal growth allows for staff recognition and allows us to strengthen our management team with staff that are currently working here and really do understand the fundamentals of our organization.
No, that's perfect. And what are some ways that Meno also just kind of encourages and supports that further education, development, training, all those good stuff?
Yeah, for sure. So we do offer in-house training for our clinical and non-clinical staff. Anytime we have new staff start here, we have a general orientation that's a 2-day training with our non-clinical instructor. So it just gives them the information about our hospital, different processes and policies, and where they need to go for certain things. And then we also have our culturally safe care, talks about EDI training, and then we also provide an Anishinaabe cultural sensitivity training to all staff. And then for the clinical side, we have a clinical instructor that works directly with our nursing frontline staff, and he offers a lot of training in-house, which is really great that people don't have to go outside of our organization. So that includes ACLS, PALS, CTAS, Code White. And then there is ongoing professional development available to staff. If there's some course that they're wanting to take, they can submit an education request to their manager and our education department, and then we'll review and see if that's something that they can take. We would definitely support that if we can, as an organization, support that.
And just from a HR perspective, just how exciting has it been just over the past few years to see just quite a growth in just different culture and dynamic here just among, the workplace at Meno?
For sure. So first and foremost, I really do think that our staff have been resilient and adaptable as we just faced a global pandemic, and it was very hard on healthcare professionals. There were so many changes. We obviously didn't shut our doors down. We had to stay open because we are essential. So I think that the way our culture adapted through that, it really shows that we value one of our Minnehaha values of teamwork. I really think that we stuck to that. And I do think that there's been a huge cultural transformation within the hospital over the last few years, which I think is great. And I think that we've really focused on diversity and inclusion for many different processes and policies within the hospital, as we have welcomed many different populations and cultures into our hospital, that we want to make sure that we're being inclusive to everyone. But I think it's an ongoing process that us as HR professionals and managers have to work together to improve the challenges that we are facing as healthcare professionals. And it will continue to be a challenge, but I think that if we all work together, this is something that we can face.
No, that's great, and it definitely sounds like there's just plenty of different exciting opportunities here at Meneawan. Just depend whether people are at just different phases of their life. It sounds like we're ready to meet them where they're at and provide them with some great opportunities to grow. So just really appreciate your time, Jade, for joining us and elaborating more on that.
Yeah, no, thank you so much. And if anyone is ever interested in positions at our hospital, and if you have any questions at all, we have a very dynamic, strong HR team, and we're here to answer any questions that you may have about working at Meneawan. But I do believe that it is a great place to work, either if you're starting your career, you're in the middle of your career, or if you're ending your career.
Perfect. Thanks so much, Jade. We appreciate it.
No worries. Thank you.
Miigwech, thank you for tuning in to this episode of the Care Conversations podcast. If you've missed a previous episode or want to rewatch an older episode, all of them are available on our YouTube channel at Menoyawan. To stay up to date on all things Sioux Meneawan Health Center, follow us on social media at the same handle at Menoyawan. We look forward to bringing you more episodes. Until then, stay safe and take care.